Hi, I'm happy to be here. My name's Tom McLellan. I'm a researcher in the field of addiction. For 2 years during the Obama administration, I was the Deputy Director of the White House Office of National Drug Control, and I helped to write Mr. Obama's drug policy. What's brought me to the field of addiction and addiction recovery is that this is one of the most pervasive and misunderstood illnesses in our country. We have about the same number of people that are affected by addiction that are affected by diabetes. One of the reasons I'm so excited about the possibilities of Reach Out Recovery is that I am and have been for a long time an expert in addiction. I've been published at many places, I'm referenced all the time, and yet when my two sons both became addicted, I didn't know where to go, what to ask for, and I didn't know anybody that did. So that hasn't changed in my lifetime, even despite all my efforts to do something. Now there's a time where I think we can actually do something about that. There are two reasons why the Surgeon General's report is so important, and particularly at this time. First, because it comes directly from the Surgeon General, there is no doubt that addiction is part of health. It's part of public health. It's not just part of the criminal justice system. Second, the Surgeon General acknowledging the terrible problems that are facing this country is part of the reason that it's important. But the final reason is that in that report, it is filled with optimism. There are ways to prevent. There are ways to treat. There are ways to intervene before misuse becomes addiction, but they're not being used. One of the reasons why the Surgeon General's report is going to be so useful is that, first of all, it has been reviewed by over 1,000 experts, but also affected individuals, and 5 of the key agencies in the federal government. In short, it is the standard of evidence. It is not something that's going to be questioned. The Surgeon General's report on addiction is just that. It is the compilation of the last 30 years of research and understanding about the biology of addiction, prevention, treatment, and recovery, but also of health systems that deliver addiction treatment.